our mission, helping seniors live full, active, and independent lives. And Department on Aging programs are part of the strategic plan related to healthy community. And by home services, I'm referring to our personal care, which is bathing assistance, homemaker with lighthouse cleaning. In-home respite is where someone's caring for someone else around the clock, and so we have a worker there 4 to 6 hours so the caregiver can leave. While the worker's there, they will do some cleaning and personal care. And then, of course, Meals on Wheels, which is our largest in-home service. And we're funded in part by Older Americans Act, and that states that we don't charge a set fee, but we ask people to give a fair share donation. And part of the process is an in-home assessment. So if someone's receiving an in-home service, there's an outreach worker or a social worker that goes to the person's home and talks with them and asks them questions to find out more about what their situation is, what their resources are, what other help they may have. And it's done by way of a laptop. But part of the assessment are what we call assessment points that are designated based on the level of need for that particular person. And the assessment points include items that are listed here on this slide: mental health, physical health, handicap level, what support they have, information such as that. So about a year ago, I came and talked with you about how we continue to target homemaker and personal care services to those with higher need. And currently, we have an eligibility level that if income is below 350% of the national poverty level, or $3,465 for one person, $4,600 for two, that if your income is at or below that amount, that you're eligible. Again, though, we target people who have higher assessment points, higher need for the service. So what we plan to do is change the eligibility to 300% of poverty, and the amounts are listed there, close to $3,000 a month for one person, $4,000 a month for two people. And then to receive homemaker or personal care, a person would have 17 assessment points or more. And then some people want homemaker only, the lighthouse cleaning and the laundry. And the current eligibility is under 225% of poverty and 17 assessment points. And it varies a little if income is higher than 225% of poverty as far as the assessment points. And we plan to change the eligibility to your income is below 225% of poverty, and there's 19 assessment points or more. And the reason we're doing this is people are calling. I've covered before the rise in the older population. What we're seeing is people who are younger, and younger for us is 60 to 70 to 80. People are younger, asking for services, needing services, asking for homemaker. And we want to target those who have a higher need. We need to budget our resources to meet the need, the request for services. So we're getting requests for services from people, and it would help them to know, okay, I don't meet the criteria at this time, so I want to be clear with them not to expect us to be able to send someone out to clean their house every other week is primarily what we're talking about. But we will be able to keep track of those requests for service through the database system, and we encourage people who called, and we tell them if your situation changes and you have a higher need because of health changes, we want you to contact us. But we will also have a record in the computer system so that if things do change and we're able to provide more hours of service to people with higher income, we would have a way to contact them and check if they still are interested in receiving the service. So there is a way to keep track of those requests, but we're just trying to be more user-friendly in a way for people who are calling so that we're not raising their expectations that, yes, I'm going to get a home care worker in the next 2 months, when in actuality, just starting now, we're having people on the list 6 months waiting for a home care worker. And the reason they're waiting is because someone else with higher need and fewer resources is assigned a worker first. And so I just wanted you to be aware that we're having that change, that when someone calls and asks for service, what we call during the intake, the in-home services coordinator will be talking with them about eligibility. And so, again, we're clear on what they can expect to receive for services because of our targeting those with higher need. And Danielle, can you think of something?
Marcy summed it up well, as we're just trying to manage the community's expectations from the program so that people don't have that long wait wondering, am I going to get service or not? That, again, we're targeting those that definitely have that higher need and that lower income, and so that we can manage those expectations of our agency as well as the community.
And part of this, at the time that we were looking at this, two of our staff attended continuous process improvement training, and this was the area that they focused on, and this was one of their recommendations, was to change the eligibility as far as assessment points and income. So, any questions?
Thank you. That's great to hear that it came from within your organization and that you empowered your staff in order to make those suggestions. So thank you for that insight. It seems very necessary and appropriate.
Okay, great. Thank you.
Any other comments or questions for Ms. Marcy? All right, thank you.
And then the next item, let me get back to your...
Yep, so next on the agenda, we have the 2019 grant application, aging 2017 to 19. So this is a grant application to contract, a statement of contract awards for any ensuing funding from Region 2 Area Agency on Aging.
Yes. And part of the information with the report includes a list of our current grants, primarily through the Older Americans Act, but also state funding. And the request for proposals will be issued, we're expecting them in July, from Region 2 Area Agency on Aging. So we're asking the Board of Commissioners to approve our applying for the funds, and then if for any awarded funds that are given by the Area Agency on Aging Board, that the director, myself, would be authorized to sign those statement of contract awards. And as the list shows, it's $1 million in grant funding. There is 15% local match. We provide normally more than 15% in order to provide the level of service that needs to meet the need for the community, but also it could be either cash or in kind, such as county support service, or the value of the building space, that type of thing.
Any questions for Marcy regarding this issue before I ask for a motion? Okay, seeing none, I'd be looking for a motion to authorize the board chair to sign this document and also the award the contract grants. We have a motion and support. Seeing no other comments or questions, all in favor say aye. Aye. Opposed? All right. Both of those have been approved then. Thank you.
Thank you.
Medical Care Facility Quarterly Report.
Good afternoon, Commissioners.
Good afternoon, Ms. Place.
Under Finance, we continue to be over budget in our census year-to-date, and we are, as of this writing, at 98% occupancy. I received back from the state of Michigan our annual CON assessment by the state that's done for all nursing homes in the state. And in our county, Jackson County Medical Care is now ranked #1 for occupancy. All of our financials, bank statements, AP processing, AR, and other financial issues and concerns have been reviewed and in our good order. And our annual audit took place by Abraham Gaffney. However, it was done in February and we still don't have the results. So we're waiting, and I know that the county needs our results as well. So we have been pushing very hard to get it done. We remain ahead of budget year-to-date. However, we are awaiting the final report of adjustments that may be made due to the audit. So we're keeping our fingers crossed. Under People, AFSCME 2098 and 139 contract negotiations began in March. We have already settled with 139, and we have one more date where we think we can wrap things up with 2098. So, and they were both very good. Residents have voiced no recent concerns or major issues at all about any of the processes in our building, and anything that was minor was immediately addressed. All resident care partner and visitor incident reports were reviewed and trended, and there was no evident trends or patterns. We continue with our core team meeting and our fireside chats, both of which have improved our care partner morale. JCMCF continues using Facebook to honor our employees and to also announce major events that we have at our building. And we recently had 1,500 hits on one of our JCMCF's Got Talent singers. It was pretty cool. JCMCF continues to offer a meeting space to community groups like TOPS and Al-Anon if they would, need any meeting space. And then in April, we held our volunteer appreciation banquet, and that was very well attended by our volunteers. Quality, we recently completed our annual survey. We ended up, I didn't have the report back at the time of writing. We did get it back last Friday. We have 11 sites, no harm levels, and we are we're deciding between 5 and 7 of them. So we would like to drop that number, or drop the level of the site. Either one helps us. We continue to score better on several quality indicators, including antipsychotic medications, pressure ulcers, our turnover rate, and our hospital return rate, all very strong. We continue to meet regularly with Allegiance to make sure that we provide Henry Ford Allegiance, to ensure that we provide the best transitions of care for the folks that we serve. We continue to work on the Governor's Quality Award, and we're about halfway through that process, and it's looking good for achieving it. And we remain at our 4-star rating. We're continuing to work toward our 5, but I just found out last week they're going to rebase it again in July, which means it's a toss of the dice. I don't know how that weight is going to change things. Growth, JCMCF replaced its phone system, and that has been working wonderfully. It was a very old phone system. I understand it was installed at the time of the building being built, and it was not a new system then, so it was very good that it lasted that long. Our strategic plan is available to all of our care partners, and it can be read and they can be engaged in the process. And at this writing, the roof was nearing completion. It is done now except for the inspections.
Okay, thank you. To start with, in regard to the star rating that you mentioned.
Yes.
So in your bullet points here, you state a 5-star nursing home rating system
Yes.
was revised in early 2015, and that took us from what we were a 2 to a 3. So that growth right there was because of the modification of the system itself.
Right.
So we have gone from a 3 within the last year then,
Yes.
being 2016, to a 4. Okay. Do you have any data that shows what similar nursing homes around the state or anything are rated, where that puts us competitively?
Yes.
Comparatively with other agencies?
On Medicare's Nursing Home Compare website, it compares everyone in the whole nation, and you just go by zip code and by whether you want it 25 miles, 50 miles, or the entire state, or whatever, and you can find all the comparative ratings.
Okay, thank you. Mm-hmm. What comments or questions might you have for Sandy?
Thank you.
Thank you for that information. Next on the agenda, Region 2 Area Agency on Aging Semi-Annual Report. Hello, welcome.
Good afternoon. Thanks for having me today. First off, I'd just like to make sure you all received the report that we sent ahead of time, because we can cover that. And I also wanted to remind you all, what the mission of Region 2 is, and that's to improve conditions affecting the lives of older adults and individuals with disabilities in our region by helping them remain independent in the community. So on the report, you'll see the funding listed out for Jackson County Department on Aging. And the community services that we fund are adult daycare, caregiver education and support training, caregiver supplemental services, case coordination and support, congregate meals, counseling, disease prevention and health promotion, information and assistance, Medicare, Medicaid assistance program, and the senior center operations. And then in-home services include chore, home care assistance, home-delivered meals, and respite services. And then we also fund the Catholic Charities of Hillsdale, Jackson, and Lenawee counties, and those are contracted services, so it's mainly transportation there with Catholic Charities. And then legal services, the funding goes for all three of our counties, which are Jackson, Hillsdale, and Lenawee counties. So legal services touch all three counties. And then it gives a list below there of the number of participants we have in Jackson County. And we have approximately 382 My Choice waiver clients, and then we serve 42 care management clients, and then we also have a program where we assist folks that want to live back in their homes in the community through our nursing facility transition program, and so far this year we've helped 40 clients transition home. We also have, several calls that come into our agency that we refer out if we cannot help them. And so there were approximately 712 calls from Jackson County residents. And then of those, 577 of those calls, we were referrals back to other resources in Jackson County. A lot of those go back to the Jackson Department on Aging, but also any other resources that are available to help those folks. And then, for our MAP, which is the Medicare Medicaid Assistance Program, there were approximately 2,327 client contacts for Jackson County residents, helping them with their Medicare, whether it's Part D, when the Part D season comes around in the fall, or other questions for people that are new to Medicare. They can call a MAP counselor, and the Department on Aging has several MAP counselors that help people, but we also help those folks in our office in Brooklyn. Other things that are happening, and Marcy alluded to, it's time for our 3-year area plan is coming up, and we are in the process. We've had several forums around the 3 counties. We even had one on our bus to Older Michiganians Day. On the way back, we did a forum on the bus with folks, and to get input into what services are needed in the community. And then we are required to have 2 hearings, and we had one last week in Hillsdale County, and then our next one is next week at our advisory council meeting at our office, and I included in your packet a listing of, the time of the public hearing next week, so I would invite you all to attend if you can. And the goal of the area plan is to outline services that we can fund through the Older Americans Act dollars and additional state dollars throughout the 3 counties. It will be presented to our board next week on Thursday for their approval, and then after they approve it, then the RFPs go out, and then that's where, like, the Department on Aging would apply for similar funding for the next 3 years. The other big focus we've had over the last several months is our education classes. We're now doing Matter of Balance, Diabetes Path, Advanced Care Planning, and others, Assistive Technology. So we are providing those classes around the 3 counties, including Jackson County, and those classes are all designed to help folks better manage their own health so that they're more successful staying in the community as opposed to having to go to the hospital as often. The other thing I wanted to remind you about is the Tomei Pace Center that has opened, and as of the last time I knew, they have 25 participants that are receiving services through the Tomei Pace Center. Most of those are Jackson County residents at this time, but it is very successful. They have different rules that they have to abide by. They can only add up to 10 participants a month. So they are, at 25, they're already doing very well in assisting folks. Another thing that's come up is, of course, we all know that the state is working on their budgets at this time. And for the next fiscal year, there is $2.5 million appropriation added by the Michigan lawmakers to the budget for the Aging and Adult Services Agency. They said it's for in-home services. We haven't got a clear definition yet on what their intent with the funding is. We're expecting it to be meals, but we have to wait to get that clarification. The other thing that has happened over the last few months was Disability Connections and ourselves each have a position that was funded through the state. We have a housing specialist, and Disability Connections has an outreach specialist. And the goal of our position, the housing specialist, is they help folks find housing that are looking to either come out of a nursing home or if they've lost their housing for some reason in the community. So we help them secure housing. And these positions were being considered for cuts because the federal program that covered those positions was being cut in half, their funding to the state. So as part of the budget committee meetings, they are putting the money into the budget for these positions. So we're really excited about that because the housing specialist that we have in-house helps many people find housing, especially for elderly folks, finding housing that they can afford and is appropriate, that they can manage in is an issue. So this position is very, very wonderful. So we're excited about the funding. I think that's all I have unless there's some other questions.
Thank you for all of that valuable information. What questions or comments might you have? Seeing none, thank you for that information.
Okay, thank you.
Next on the agenda, we have a Lifeways monthly report. Is there anyone here to come to the podium and present? If not, we do have it on board docs. Next, we'll move on to the Department on Health and Human Services, DHHS, and you are not Zoe. We do have Zoe's report in our packet, and welcome back, Mr. Rose.
Thank you. Good afternoon. I am just going to briefly kind of go over Zoe's report that I believe that she submitted to everybody. The first part is pathways to potential expansion, which is placing cash assistance and Medicaid workers in the schools within Jackson County. We have been very successful over the last year that this has been in place, and we're looking at trying to expand that as well into some of the other schools. Our director, Mrs. Lyons, has met with superintendents in the Jackson County schools and tried to discuss about the possibility of adding 4 more districts as part of this program. She's also requested some information on third grade reading levels to help make some determination on which schools might be the best to target at this point in time, and we're waiting to get that information back. And looking at the possibility of some possible cost sharing, which is something that we have done with other areas such as DOC as well as Allegiance Health in the past. And I think I'm just going to skip around just to kind of keep in line with the cash assistance piece as far as those roles is the Employer Resource Network. There has been some collaboration between Jackson County United Way establishing an Employer Resource Network which is similar to the Pathways to Potential, but instead of having workers in the schools, that actually be located with an employer. You're probably looking at maybe more of the larger employers that would be able to employ some of the clients that we may have that come to the department for Medicaid or Medicare or cash assistance, and having a Pathways to Potential worker there, located there, or a staff person there would allow them to be able to do, looking at any changes they need to do for their Medicaid or their food stamps, either reducing that based on their income, or making sure that they're able to be eligible or receive daycare assistance, will allow that individual to not have to leave work for a long period of time. They could meet with a worker maybe on a 15-minute break or during a lunch break and reduce the amount of time that they would have to leave for work, and be able to be more productive for the employer. And she's indicated this has been done in other counties, which I'm familiar with, many other counties, including Kent County, which is where I had been for about 10 months. This has been something that's been very successful over there, and reducing the amount of people needing to be on assistance as they've gotten their jobs and been able to maintain those jobs longer. The other piece is the at-risk youth pilot. Has a formal name now called Jackson YouthNet. It's still in its planning stages, but it is a group of community members that are seeking to develop some strategies focused on teenagers who are at risk for court involvement or law enforcement, to try to maintain them here in our community with reduced interactions with law enforcement, and hopefully maintain their placement here in the community. The other one is the collaboration with Save Our Youth. Jackson County Judge Phillip had requested some assistance in creating a diversionary program. It's actually for ages 18 to 24. I think this says 17, but it's actually 18 to 24, where they're facing a adjudication on minor offenses. Primarily what Judge Phillip has seen is that many of these are individuals that are having difficulties with obtaining employment and not having really a sufficient mentor involved. So what we've got is we're working with Thomas Burke from Save Our Youth, as well as Ken Toll of United Way, and putting together some strategies on an assessment process, having a kind of a mentor that is either an advocate or a coordinator that's working with them, connecting them to resources in the community. The department was, we stepped in looking at it from a cash side as well as from a child welfare side, whereby we are able to maybe utilize state dollars to help these individuals that might be eligible for services that they would not have known about in the past. One of the other ones also that Ms. Lyons has been part of is the Jackson County School Justice Partnership. So what they're looking at doing is creating a educational summit, which is similar to the drug summit that's been going on for a couple years here in Jackson County, with the plan that the summit will provide educators of all grade levels with tools and information on how to help our children and families. And then the last piece is on our county child care fund. We continue to monitor this closely, and at this point it looks like we may need to move some just line item funds from family foster care to our residential line to cover those costs, but no increase in the costs at this time. And that's it.
All right, thank you. The one thing I did notice in her report, it said she's including a save the date for that.
Yeah,
So
I didn't see that.
Yeah,
It
that's
was
okay.
missing?
Just
Okay.
shoot it our way, and I'll share it so we can get that date on our calendar. But thank you for that information update. What comments or questions might you have? All right, thank you.
Thank you.
Thank you for the information. Next on the agenda, we have the Health Department monthly report. Welcome, Richard.
Thank you. Good afternoon, Commissioners. Hope your day's going well. We have, obviously you have my packet, my report in your packet this afternoon. I just want to highlight a few things that I've identified. You're probably aware that we are continuously doing workforce development in one way or another, if you will, with our staff. And a couple of things that we've been engaged in here relatively recently has been involving administering a public health core competency tool to all of our staff in the health department. And we did it at a general staff meeting on May 4th and went very well. This really looks at the degree to which our staff are competent in carrying out the 10 essential public health services. So there are 11 domains, and there are probably a dozen different competency-related questions in those domains. We think that this is a really good thing for us to do at this point in time. It also ties in very nicely with the next item on my report, the Southwest Michigan Workforce Development Plan Initiative. This is a cross-jurisdictional sharing grant that Branch Hillsdale St. Joseph County entered into with the state, invited 9 other agencies or 8 other agencies to join them. We decided to join because it fits with the work that we're already doing. And I think it'll help establish a really systematic approach for doing this. All health departments have the same core competency needs, so it works very well. I'm very interested in perhaps a more efficient approach to getting our staff trained and educated about the core competencies, and a learning management system that uses computer-based learning modules might be a really efficient way of doing that across the state, across our region for sure. So we're participating in those meetings with Branch Hillsdale St. Joseph and the other 7 jurisdictions. Update-wise, under emergency preparedness and response, my report contains details concerning this intentional food contamination crime that occurred in Ann Arbor actually last month. And we did have one Jackson County resident contact us who indicated that he had eaten foods at Whole Foods in Ann Arbor on April 28th and developed some signs and symptoms consistent with, I guess, what would be food poisoning, if you will. We weren't able to tie anything back to the specific contamination event that occurred there by the individual who sprayed a mixture of mouse poison, alcohol-based hand sanitizer, and water at 2 area stores there. But we did follow up with him and contacted him and advised him to follow up with his primary care physician. So that item is pretty well resolved at this point in time. I haven't heard anything further about it. We had a very successful application pool for our Director of Health Education, Health Promotion. As you know, Michelle Bullinger is retiring at the end of this week, basically. We selected 4 candidates, and they were all top-notch candidates, if you will, including one internal to the health department. We did ultimately decide to select our internal candidate, Michelle White. I think most of you know Michelle. She's done an outstanding job in teen pregnancy prevention for many years and has been working in the health department for about 20 years. So we're pleased to be able to select her. We do have other positions that will be opening up as a result of that, and we've encouraged the other applicants to consider some of our other positions in the health department. Update for you on the post-accountable health communities model. There's a lot of work and conversation going on now with the state innovation model, which we're a pilot test community for that, and we're hoping that that will go well for us as we move forward into the fall. The state operational plan for that model has been developed and disseminated. We had the opportunity here in Jackson County to provide input and review comments to that, and so we hope to see that come out with more detail in the relatively near future. The Social Determinants of Health Brain Trust, that's how they described it, is actually EPIC's national approach involving people from across the nation, if you will, in making updates and changes and enhancements to the EPIC electronic medical record. So I was connected up with someone from their national office based in Wisconsin, and participated in a meeting with them by teleconference in the month of May. It was very interesting. They are working on incorporating what we refer to as the social determinants of health into the electronic medical record. And that's everything from financial resource constraints to their housing situation, their employment situation, and even their income. So there's a lot of things that will be very beneficial for the EMR to incorporate relative to individual registered patients that will help us with future public health research and planning and service delivery. So I'm hoping that they will do that. Under personal and preventive health services, we did have our annual Michigan Care Information Registry and School Information Immunization Registration Service in service. Went very well. And I'll be speaking to the school superintendents on June 20th to talk a little bit more and reemphasize our expectations about first day exclusion for children who are not in compliance with that particular requirement for school entry. We continue to work, if you will, in trying to recruit the right people in positions within the Personal and Preventive Health Services Division. We're looking very closely at the compensation study data with Richard Martinchek. We're a little concerned that the number of applicants that we're getting and the quality of applicants that we're getting for RN positions is really not what it should be. In some cases, we only get one applicant, and oftentimes if it's an individual who's coming right out of nursing school, they haven't had the chance to get their feet wet yet clinically with patient on-hand care experience, and we don't have a lot of that at the health department. So oftentimes we're not competing very well from that perspective, but also we are, I believe, below the minimum lower end of the range market level wise for registered nurse beginning pay levels. So I think we're going to need to do something about that. We did participate in a health and recover event with the Jackson Recovery Resource Center. I didn't put the detail here in my report. We were actually there to facilitate additional screening and testing for HIV, and that's what we did on that particular day. I'd make one other comment concerning HIV in general in the community. We have finished our annual report at the health department. I hope to come to you next month with that report, but also to give you a presentation on what HIV prevalence and risks looks like in Jackson County. It's rather revealing for us. We had a suspected mumps case that we were working in May. Nothing further to report on the case. It seems to have resolved. The communicable disease office staff were very much involved in that, and it came out okay relative to the school and to the family. We continue to have our staff trained in CPI. We had 4 of our staff participate in the training in May, and it was nice to see them focus on a problem that we're already aware of in the Human Services building as far as people entering the building and having difficulty getting to their destination. One of the things that they identified, which, you know, I'm really surprised we didn't figure it out previously, is that if you get in the elevator on the ground floor of the HSB, there's no directory in the elevator. It doesn't tell you what's on each floor. So it's a very simple thing, but that's something that our CPI team that was getting the training identified as part of what we could do to help enhance people getting around the building. So it's a small thing, but I don't know why none of us who ride in the elevator pretty frequently didn't see it. But anyway, that's now been taken care of. So we have some other signage issues here and there as well.
Richard, for a second, if I can go back to the mumps case,
Sure.
the suspected mumps case. So the results were negative. It was, I mean,
Yeah, I actually don't know what the results
Okay.
were. I can check on that and find out.
but just for clarification, if that would have been confirmed, then any children, any students who enrolled in that school and were to come within exposure to that infected child would have been asked to stay home. Is that correct?
They could be asked to stay home. It depends on the specific disease. In most cases, we would probably only be talking about children who had perhaps waived the mumps vaccine. So those who are not protected would be the most likely ones that we would indicate to the school district. If they were in the same grade and they were considered to be exposed, would have to be kept home for probably 1 to 2 weeks.
Okay, same grade, so not necessarily same classroom.
Not necessarily, well, if the grade is in a classroom, and you may have multiple classrooms with the same grade, but it really needs to be in the classroom,
Okay,
the same classroom.
all right, thank
Yep.
you.
You're welcome. There's quite an update there for you on Teen Pregnancy Prevention Initiative updates. We're doing an outstanding job, as you know, with the program, and happy to answer any other questions you might have about that. Our car seat safety program continues to participate in the community with other partners on April 16th at Jackson Community Ambulance. it always is interesting to me sometimes the number of car seats that get destroyed. And it's primarily because they have reached the end of their service life. These seats actually have an expiration date on them. Most people probably are not aware of that. But in a hot car, over 3 to 5 years, they will deteriorate to the point where the plastic components begin to get brittle and will actually break. And so they're considered unsafe after their expiration date, and we work with families to get them removed and get them replaced. So. Abstinent program updates, I have a number of them for you there as well. I would just touch on the fact that this is a program that we continue to get additional funding from. We're offered funding almost on an annual basis of $10,000 to $20,000 more, and this doesn't happen across the state in every program, that's operated either by health departments or others. So I think they're very pleased with the work that we do here in the community, and we're continuing to push down the teen pregnancy and birth rate as a result. So this is kind of I think a recognition and a reward for doing the good work that we're doing. Under environmental health, the lead poisoning prevention updates, there's a couple of those there for you. I've also, it's not in my report, but I'll mention it, I've drafted a memorandum of understanding and shared it with the city manager and Jennifer Morris, who is the department director for neighborhood and economic operations, seeking to collaborate and enhance our childhood lead poisoning prevention program related activities in the city. There's no exchange of money or resources involved in it. It's just a way for us to collaborate together and to share information that helps both of us do a better job with that. So that was sent to them this morning. We've offered to meet with them to hash out any details, but then when that is completed, it would come back through the board for review and consideration. Arbor Village Mobile Home Park, this has been an ongoing issue involving our Environmental Health Division, but also Representative Pileski has been very involved in it. He's kept us all very well informed. He has pulled together the multiple local and state agencies that would need to address some ongoing sewage disposal and water quality questions and concerns. It's pretty much resolved at this point in time. The health department has offered to do a free courtesy inspection of the mobile home unit that was reported to have some backup sewage problem overflows internally. And we would go out to address that and identify any health concerns and provide recommendations to the unit owner themselves, or tenant, if you will, on anything they might need to do. That was probably well over a week ago. We've not received a call, but we will go if we're asked to go. We had a good outcome for our self-assessment report for the on-site wastewater program. We meet all the minimum program requirements there, and we had a couple other items going on at the animal shelter, an adoption event on April 23rd, 2 dogs and 2 cats adopted. We do have another event that's coming up within the next 2 weeks. I can't remember what the name of it is, but there is always an adoption event being planned by the shelter staff. And one little item there concerning kennel gates. Apparently, Don is working to put some stainless steel kennel gates in the puppy small dog room with funding from the Friends of the Animals. That's pretty much my report.
Thank you. What comments or questions might you have? All right, seeing none, thank you for that information, Richard.
Welcome, thank you.
On the agenda next, we have the claims from May. I believe you've all had a chance to look them over. We have a motion and energetic, enthusiastic support to make those claims taken care of. All in favor say aye. Aye. Opposed? Claims motion passed. Other meeting minutes, there are none in board docs. July reporting schedule. In July, Department on Aging, Health Department, Lifeways, Animal Shelter, and Community Action Agency. That leads us to the second, public comment. Is there anyone that would like to address the board? Seeing no other public comment, are there any committee member comments? Commissioner Shotwell?
Just a reminder to the public that we will be 1 week later next month.
Thank you. Any other commissioner comments? Seeing none, at 12:48, we'll adjourn to the call of the chair.